Hello, hello.
Hey, welcome. Come on in.
How are you?
I'm doing great. Welcome to my apartment.
Alrighty. Are you ready for your 73 questions?
Yes, I am. Even though you just got here.
Yeah, totally not staged at all.
Let's go this way.
So, what is your name?
Hi, everyone. My name is America. I am an intern in general surgery, and I don't know. That's it.
So, where'd you go to undergrad?
So I went to undergrad at the University of Texas in Austin.
And medical school?
I went to medical school at UT Texas San Antonio.
Did you take any gap years before going to med school?
No, I did not. I went straight through.
So, what was your favorite part of med school?
Something's ready. My favorite part of medical school was when it ended.
What specialty did you think you were going into on your first day of med school?
Let's see. I thought that I was going to be an obstetrician gynecologist.
And what changed your mind about that specialty?
I saw my first live birth and thought, wow, I don't like that.
Were there any of these specialties you immediately said, like, absolutely not for me?
Definitely not neurology.
What made you fall in love with general surgery?
So I really like how there's a medicine aspect of general surgery, but there's also a place to be able to use your hands and get lost into something that's very technical.
So how long does your training take after med school?
My residency is going to be 5 years long.
You plan to do any fellowships later?
Mm-hmm.
How about any other degrees, like an MBA or an MPH?
I really am thinking about getting an MDA because I would like to, an MBA. I really am thinking about getting an MBA because I would like to own my own business someday.
What would you say is the most unique part of your specialty?
The best part of my specialty is definitely the surgery.
Why should someone choose your specialty?
I think everybody should be a surgeon because it's just the most fun.
Are there any reasons why someone should not choose your specialty?
Don't choose my specialty if you like having a life.
Are there any stereotypes about general surgery?
Yes, that we're all mean and men, but we're not.
I guess, are any of the stereotypes true at all?
No, because I'm also not a man, and I don't think I'm that mean.
Okay, well, now that you're in the fun part as a resident, is it true that you guys get pimped with a bunch of questions all the time by attending physicians?
Yes.
What's the craziest question you've ever been pimped on?
I got asked to say what the spirit animal of a whole bunch of surgeons in one room was.
Excuse me, what?
Yes. That was very dumb.
Alrighty.
What else is interesting? Ooh.
Are you ever nervous at all coming to your shifts?
No, I'm not. I'm actually very excited to go to work.
Nice. How many patients do you see on an average day?
So the number of patients I see on an average day, goodness, like 20 a day?
What's the most amount of patients you've seen in a day?
Probably like 36.
Ooh, how many procedures do you do on an average day?
As an intern, I am lucky if I do 3 a week.
How many hours do you normally work in an average week?
So in an average week, I work, I think around 50 to 60 hours.
Okay. What time do you normally wake up?
6 a.m.
Ooh, what time do you normally leave the hospital?
I normally leave the hospital around 6 p.m.
How many hours of sleep are you typically working on?
Probably 6.
How many hours of sleep are you working on right now?
Right now, I'm on 12. It's my day off.
Nice. Do you have to take call at all?
I do. I took call twice last week.
How long does it take you to chart at the end of the day?
So I don't chart. That's something nurses do typically. But how long it takes me to do my notes? Probably about 30 minutes.
Are you a night shift or day shift person?
I am a day shift person.
Who are you most thankful for in your care team?
I'm most thankful for my upper level and my chief because everything falls on them if something goes wrong.
What's the funniest thing you've seen in a patient note without violating HIPAA, of course?
Oh, goodness. Or violating morals. Somebody put an apple in a certain place and I had to take it out.
Ugh, that's kind of gross. What's the most common medical advice you give to your patients?
Stay out of trouble, please.
What's your favorite nerdy random medical fact?
Nerdy random medical fact. I guess that. Geez, hold on. I don't know. Ask me a few questions.
Okay. So I guess we can't really avoid talking about it right now. But how has your specialty been impacted by COVID?
So surgery hasn't really been affected by COVID that much. A few of us have had to go to the COVID unit, which is kind of difficult because we don't specialize in intensive care medicine mostly or as much as internal medicine does. So I've been having to go there, and I personally don't have any ICU experience. We also have had to cut down a lot of our elective surgeries because there's just not enough beds in the hospital. So it has been affecting us a lot. I think it's been affecting the emergency room physicians and internal medicine the most, though.
Okay. What's all this?
So this is a very special portrait for me. It is a list of all of my worst evaluations from medical school. But nice. I still graduated.
Inspirational.
Mm-hmm.
Okay.
And some artwork from my fans.
Aw, that's so sweet.
Thank you.
So, okay, we've talked a lot about life inside the hospital. Now, how about life, when you clock out? What's your favorite thing to do when you're not working?
My favorite thing to do when I'm not working.
What is?
My favorite thing to do when I'm not working is probably go on YouTube and eat and lay in bed.
So, do you have a significant other?
I don't.
Does your family ever ask you for random medical advice?
All the time.
What's the weirdest question a family or friend has ever asked you?
Probably, can you take a look at my feet? Why do they hurt so bad?
Is that vaccinated?
Mm-hmm. My arm hurts really bad right now.
Aw. But at least you're taking a step to be safe.
Mm-hmm.
Any pets?
Just one. Just one lucky guy.
I was going to say, are you a dog or cat person? But I think that answers the question.
No, I actually, I'm both. I'm an everything person. I just happen to have a cat because I don't have a lot of time for a dog.
What's your favorite animal, not a dog or cat?
My favorite animal, I'd love to have a hamster.
Okay. If you could have dinner with anyone in history, what would it be? Or who would it be?
Ooh, I would like to have dinner with... Goodness. That's a hard question. Oh, gosh. Look at my birdseeder. Okay, anyway. If I could have dinner with any deceased person, it would probably be... Gosh, this is a really hard question.
Should we come back to it?
Yes.
All right. Well, instead of asking who would you have dinner with, what would you guys be eating?
Ooh, lobster.
What's your favorite dish to eat?
Oh, it's making a sound. My favorite dish to eat is fried rice. Fried rice, chicken Alfredo, and sushi. I can eat sushi 3 times a week.
So what's your favorite kind of restaurant then?
My favorite type of restaurant, probably Vietnamese.
Nice.
What is your ethnicity?
Vietnamese. So, are you a coffee, tea, or soda person?
I'm a Diet Coke person. I don't like coffee. Wait. Oh, how long ago did I put that in there?
Not sure. What you got in the oven?
I have a cookie.
Why is there just one cookie?
'Cause it's for me. And then for you.
Oh, thank you. I guess I can't really argue with that explanation.
So I was going to tell you about this. This is really good, but I dropped it on the floor.
Oh, well, we'll figure it out later. So how much water should you be drinking every day?
So the human body is actually very good at letting you know when you're thirsty. So you should just drink when you're thirsty.
Oh, do you have a favorite meal from the hospital cafeteria?
Oh, they serve sushi.
Nice. What's your favorite healthy snack?
Sushi.
What's your favorite guilty snack or cheat meal? Sushi. All right. This one's gonna be controversial. All right.
Ooh.
Pineapple on pizza. Yes or no? Be prepared to be judged by the internet.
No, it doesn't belong.
Good for you. Are you an Apple or Android person?
I'm an Apple person.
Any artistic hobbies you keep up with?
I really like hair and makeup, and I like YouTube editing. I mean, video editing and YouTube videos.
Okay. What kind of music do you listen to? On shift or in the OR?
So, everything. I even listen to country sometimes. I listen to everything.
Do you ever listen to music to pump you up before a shift?
I listen to music all the time to pump me up for everything.
So, what's the best way you relax after a long day?
The best way to relax is to lay in bed and eat.
Oh, I think there's a lot of people that will agree with that. Are you a night in or out on the town person?
I like to go out.
Yeah, indoors or outdoors person?
Outdoors.
Beach or mountains?
Mountains.
Would you consider yourself more of an introvert or extrovert?
You know, I honestly thought I was an introvert until this pandemic had happened, and then I realized, you know what? I'm actually pretty extroverted.
Was that personality trait a factor in choosing your specialty?
No, not at all.
All right, well, thank you so much for your time. As we wrap up, I want to ask a few reflective questions.
Sure.
What did you think you were going to be when you were a kid?
So I thought that I was going to own a bakery when I was in middle school. But I can't bake. I honestly think that cookie is overdue.
Is there a different specialty you think you could have done?
I think I would have really liked psychiatry.
If you didn't do medicine, what do you think you'd be doing right now?
Jeez. I think I would have been a airline stewardess and just traveled the country.
Were there any times you doubted you would make it as a doctor?
Oh, yes. Pretty much every day.
If you could change one thing about the medical field right now, what would it be?
I wish that people didn't have to worry about whether or not they could afford to come into the hospital.
What can a medical student do right now to prepare to go into this specialty?
Say that question one more time.
What can a medical student do right now to prepare to be a general surgeon one day?
So what medical students can do right now is just stay focused in class, try to have a good time as well. I think that they're both pretty important to maintain a very healthy psyche, but also get the things that you need to done. Study when you can, and I think the most important thing is to really search, really explore what makes you happy and what you could really see yourself doing for the rest of your life. If you make the right decision, you won't regret it.
So, speaking about regrets, if you could go back, would you change any of your experiences that got you where you are right now?
Whew. I wish... well, in college, I kind of had somebody who was pretty toxic in my life tell me that I could never do what I do. I should have listened to them less.
All right. And finally, what would you say to the aspiring physician right now in either high school or college?
What I guess the only advice I would have to say is you never know unless you try. Like, for instance, this interview. He never stopped emailing me, and now we're doing it. And so I would say the same thing for everybody else.
Way to expose me. Thank you so much, Dr. Revere. And thank you for your time and expertise.
Of course, no problem. Oh, let's go back. Alrighty, let's go see if that cookie's